Professor John, Professor, and also a friend from Russia and Uzbekistan. So my topic will be today is CVD prevention in China, challenge and opportunity in the AI-enabled digital health era. So in China, actually the chronic non-community hospital has been listed as a national goal for the health plan, and in 1990, cardiovascular disease prevention and treatment is one of the major targets. The national goal for CVD in 2030 is the age standardized CVD mortality will decline from 238 in 1950 to 190 in 2030. But if you see the most recent available data, currently China have an age standard CVD mortality is 280. It's much higher. The gap is much wide between the national goal, and we're actually much higher than the high income country, and even higher and the mean level of the high middle income country. So it's a challenger for China, and because there's many effort already paid, why we still have very high age standard CVD mortality. Then we just today, before yesterday, published a new paper on Nature Review Cardiology. It's an invited paper. We're trying to find, actually this paper is we're trying to identify, summarize the major barriers, obstacles, challenges to implementing preventive strategy, solve the problem, highlight the core obstacle, achieve the national goal for cardiovascular health in China. Then we discuss the potential value and the challenges associated with the digital health care and AI technology in the implementation preventive strategy in China and other countries with a similar situation. So actually, it's a very beautiful picture, but this slide is not accepted by the journal. It's too complicated. Then we actually identify 5 is the major obstacles. The first one is the inadequate healthcare resources. The second is the high hospital deaths. And I'll be one by one introduced. Then we actually trying to search all the currently available the digital health intervention and the AI technology already available, already used to trying to use in solve the problem, and also so what is the barriers and the future research needs for those AI technology. The first one, among the 5 priority obstacles we identify for the how to reduce the gap between the national goal and the current age standardized CVD mortality. The first one is the absolutely inadequate healthcare resources and the inequality, disparity, the distribution. If you see the international comparison of health access and the quality index, that index is regarding the resources capacity for the healthcare. Then in 1990, China is among the country. The Russia is a little bit better than China. The color is lower. China in 1990 is we have low resources. But in 1919, that we much improve, especially for the working. The age group is still in the working stage, but much proof also for the old people, but a little bit lower the resources for the old people. But still, China is a little bit. It's not a little bit. I think still compared with the increased number of people with the risk factor, with the coronary heart disease, with stroke, still we have limited resources. Now, if inside China, if you compare the different region, different provinces for the same quality, the access quality index and the universal health coverage, that's a very important index internationally for health resources. You find it's not huge, but very disparity in the distribution of health care. Then Actually, the distribution or availability of healthcare is closely related with the economic level. So if you put the economic level, social demographic index in the low level, then you see we have a big disparity. The higher the economic social situation, the higher the capacity for the primary prevention and for the secondary prevention. Then the higher the prevention capacity, the lower the stroke and the coronary heart disease. So I think social demographic is social economic level is most important markers for the capacity prevention. It's capacity and also related with your problem of CVD. I think that's the first. Then currently, I'm sorry, a little bit I don't know how to happen, but the potential role AI enable digital healthcare to mitigate the pressure of inadequate healthcare, include the internet-based hospital and the new model of digital doctors. Dr. Twin, the remote training for the primary care provider, especially in the remote area, and the AI assistant allocation of healthcare resources as a potential. Then if we see that there's paper regarding summarized global trend in internet hospital and the electronic prescriptions, then you find China actually after US, English, and the German as the fourth, the country with some publications. But if you see the real number, rapid development of telehealth platform service in China in 2014 is the first internet medical service launching in Guangdong provinces. Then in last year, there's over 2,655 internet hospital or clinics has been established. Then currently is almost 30% tertiary hospital and 53% second hospital across all the administrative region in China offer internet medical service. And also in Zhejiang is more advanced provinces, they actually developed an AI and enable digital health assistant, no Anzhen, that you save the diagnosis or save the treatment launching in Zhejiang in last year. Then they actually designed AI doctor twins. The doctor is like the famous doctor, actually is an AI doctor. Then 24 hours service and the report interpretation and health record review. Then they provide 20, it's more than 20 medical and health service from a variety institute in the provinces. Then it's more than 17 million individual visit. Average time save is about 20 minutes per patient. It's a very it's very convenient for the people, especially for living in Zhejiang. But there's many barriers and the future research need. First, we don't have a systematic analysis for the problem, strategy with the feasibility and sustainability for the internet hospital. But if the hospital, the doctor sit there through the screen to see the patient, still is time consuming, still you need doctors. But if you use a model of digital doctors, so there is a liability and the legal issues. Who is responsible for that? No extensive insurance policy support, lack of quality of care evaluation, the resource data share and the cost effectiveness. So even there is many internet hospitals, still we need sit down to see what the problem they can solve, what really we need for the internet hospital. That's a issue for this, the barriers. And another big issue for China, the predominant obstacle is out-hospital cardiovascular death. The paper published in 2022, actually among the different time from 2025 to now, and for all the cities, in China, on average, 82% of CVD deaths occur outside hospital, and 77% died in home. Among those who died in healthcare agency, most of them died in the primary healthcare setting. So if such high percentage died outside, whatever you improve your facility in the hospital, you cannot reduce the CVD the mortality in this situation. So because the time is, I don't have time to have a detailed introduction, but we identified first is unexpected sudden cardiovascular death. The second is the symptomatic CHD patient with the low risk features, because if we use a risk assessment, they belong to the low risk population, but still actually they have severe CHD already, and the long delay time from symptom onset to the medical contact, the emergency care, and the culture and the financial factors. The culture is some area they want to, the old people, they want to die in home, it's not in the hospital, in outside. So that for reason is we identify. Actually, there is no systematic study for this important question. Then currently it's a very exciting area, many effort for the digital and health AI assistant tool to early detection and prediction. The ischemic heart disease is not long-term prediction, it's short-term prediction, and the malignant arrhythm and the effective cardiopulmonary resuscitation, the CPR, include the wearable electronic CHD smartwatch, and AI CHD and AI CT angiographic tools can have some not recognized signal by human, and home-based supporting system, AI-powered automate the AED, and virtual reality training, and also in Korea they have a CPR performed the robot. So I think that is already available or is already under research. Then is the future research need is early process diagnosis coronary heart disease. Currently, we don't have early diagnosis method can widely use and improve accessibility or AI-powered tool for timely prediction of sudden death. And in fact, the home-based AI-powered CPR facility and the supporting system. Currently, the distribution of AED in China, the lower area is for 5 per 10,000 people. It's much lower than the average level in many other cities. And so that's they already improve a lot, but still the people. And also some new technology bring a new hope. There is a paper published on the resuscitation. Is in the new many new technology is already under development, the R&D, and or available in the next 10 years. Maybe in 2034, as predicted. There is many new technology to help to predict and rescue people with the sudden death. And the third is the most potentially is a huge problem, is unhealthy lifestyle in children and young people. I would say because they're our future. In the next 20 years, they'll become adults. Then if you see the survey, national survey, among the children and adolescents in the 7 to 17 years, only 1.7% meet the criteria ideal cardio health. So that's a big problem. And China have the largest number of obesity children in the world. So there's many effort trying to solve the problem, use AI-based electronic apps, deliver health education, support health dietary habit, support physician activity, aids in stress management. But so far, limited evidence for the effectiveness of this AI-based electronic app or game. And many barriers and future research needs is this is one of the China Children and Adolescent Foundation. They actually support the smart sport and enter campus, empower physical education in rural area. So there's many effort, but they need a evaluation, the effect or impact. I believe that's a very good start. But some really the RCT study in other countries showing for education, how to choose the healthy food, failed. The user gave, the children is interesting, but after that, still they choose the one they want to eat. It's not health food. So it's not very easy. Ji Guang actually is one of the co-authors for this. I'm talking about our publication. Then the poor adherence to prevention strategy and treatment, just like the previous speaker regarding the adherence rate, control rate in your country, we have the same problem. Then if you see the major risk factor, the control rate, treatment rate, is really, it's like hypertension. We have recent studies still is reach only 17%, and we have lowers the target rate for LDL-C. And diabetes much better, but still is need the room to improve. So there is many effort. Actually, most of the publication is publishing in this effort. Use the short message service, wearable device, mobile health application, telemedicine service. Then only evidence showing that have certain effect is for diabetes, but very limited evidence. Many study, many meta-analysis, very limited evidence on the reduced blood pressure and the other risk factor. So we need to find a new way and uncertain reliability of data measurement wearable device, because it's not a really medical certified device. So it's a problem, and also clinical implication of digital health tools is waiting for the promotion and trying to find a better way. We use the digital health and the AI technology to help increase the adherence. Actually, I buy for the lipid, the small machine for the lipid measurement. I think it's very helpful. The last one is disparity in the quality of healthcare in China. There, in the primary healthcare providers, there is a high percentage. They don't have actually the training in the medical school. And also, even in our study that we did in almost the tertiary hospital for the acute coronary AMI, for the STEMI, the treatment, you see the major guideline directed therapy, medical therapy is have a big distribution. I mean, the quality care is very different, even in the tertiary hospital inside China. So there is a most exciting and most effective area using the AI-enabled digital healthcare, include the AI-powered smart hospital, AI-assistant professional training, AI-assistant imaging solution, AI-assistant clinical decision supporting system. Then, such as these studies use in Fuwai, they so use the available. There is a increased availability of MRI in China is increased. The quality of clinical report have been prevented by the shortage of qualified professionals. Then the Fuwai Hospital, they did Professor Zhao Shihua, they use a validated computerized AI assistant cardio MRI model. Then they screen a diagnosis 11 type of CHD. Then it's very high reliability, accuracy. Then this AI assisted model require only 56 seconds to one imaging report. But if you use a radiologist, they need 286 seconds for one report. So I think this is a very successful study. Then they're really trying to use in the clinic in China. Another study in China is showing they use AI technology trying to identify the very quick the the image on CTA. Then they can accurate in the 87% for plaque classification and 91% for stenosis grading in the very short time. So I think that's all the successful is in the image part. And also, National Center, Fuwan Hospital, they did a study. They trying to help the primary care in hypertension. It's a problematic cluster randomized control trial. Then because the management hypertension in the primary health care, especially in countryside, is not very optimal. Then after the intervention, use AI decision-making system, then they were much improved for the hypertension control and also the right treatment. And also for atrial fibrillation, there is a countryside, they use AI help the countryside village clinics can treat and diagnose atrial fibrillation correctly. Because our time is up, so the feature AI, there is a huge potential, but some concern, some uncertainty, because AI can thinking, can behavior, there is an inherent nature. In future, then they are creative, they are generative. Then how we control that, how we actually to correctly to use this new technology, then to help us to overcome the barriers, but at the same time, it's not bring any side effect for the. So before I finish my talk, I would like to thank you everyone.